Okay, welcome everybody. This is Janelle Matuszak. I'm one of the lawyers here at Hygiene, and today we're doing the third or fourth part of our series of the coronavirus COVID-19 series. I'm going to talk about keeping employers or keeping the workplace safe. All right, I had this all set to go to talk about some CDC recommendations and OSHA recommendations, and then yesterday we got this stay-at-home order from the health department. So I'm going to start with that. As most of you know, so first, everybody's probably aware that there's a stay-at-home order in place right now. Actually, it starts at midnight tonight. And what this means for your workplace is all businesses and operations in Ohio, except those deemed essential businesses and operations, are required to cease all activities within the state. Home-based businesses are allowed to continue. Working at home is allowed to continue. And unless you are an essential business or working at home, you're supposed to stop. The thing is, the list of essential businesses is really broad, includes a lot of things. I put some of the essential businesses listed on this PowerPoint, but it's not everything. So if you have questions, give us a call, email us. There's a lot more things included than I listed here. The first, businesses that sell supplies to people that work from home, those are all allowed to stay open. You probably know grocery stores are allowed to stay open. Restaurants, if the food is going to be consumed off premises. Laundry services, hardware, supply stores. What you probably don't realize though is churches are allowed to stay open, the post office, hotels and motels, funeral services. Of course, gas stations, you can guess that. Banks are allowed to stay open. Even though colleges and the rest of the school system is closed, you can go to work at a school if it's for purposes of distance learning. Professional services are allowed to stay open, and those can be accounting firms, insurance. I believe real estate agents are under that. Title services are allowed to stay open. So our law firms could stay open if we chose to. Critical labor union functions, home-based care and services can stay open, manufacturing services, distribution and supply chain for critical products and industries. So if you have a manufacturing facility or a distribution facility, it can stay open as long as it's for critical products and industries. Critical products and industries include a lot of things you would think of, like medication, healthcare, but also communication, technology, and communications. There's a whole list of things that are critical services. So if you have questions about that, contact us. We can help you out with that. I should say while I'm pushing the slide here. Tomorrow, Elizabeth Baldock from our firm is going to speak, and she'll go into probably a little more depth of this. She's doing a legislative update. I know she's going to be kind of covering the same material. So if your business is allowed to stay open, if you are an essential business, you have to practice the social distancing requirements. And so this is a little more strict than what you've heard before. One thing the Department of Health wants you to do is designate 6 feet distance between your employees. They've been saying that, but now they actually want you to use signage or tape or some kind of barrier where the employees know what is 6 feet in the workplace. This starts tomorrow or midnight tonight. They also want you to, if you're a retail establishment like a grocery store, they want you to establish 6 feet apart for customers. And there should be some kind of barrier designation where you separate people. So that's a new requirement. You're required to provide hand sanitizer and sanitizing products. That's not really a new thing. Have it available and ready for employees, So cleaning products, hand sanitizer, all those things to keep the workplace safe and clean. Asking that you have separate operating hours for vulnerable populations. So I've probably heard a lot of the grocery stores are having different hours for the elderly. I don't know if restaurants are doing that, but the Department of Health is asking that if you serve the public, that you have different hours for vulnerable populations. This online and remote access, this is not talking about working remotely. This is notifying customers about your hours online. So if you are closed because you're not an essential business due to the coronavirus or COVID-19, they're asking that you put a post on the internet and let everybody know how to reach you and when you'll be open. And that's just so it prevents people from leaving their homes to go to a business that's not open. They're trying to keep people home as much as possible. Okay, further requirements not under the social distancing umbrella for businesses. You're supposed to allow as many employees as possible to work from home. So if you're in an office setting, a lot of offices are doing that. One Meeting Council is doing that. We're doing 98% of our business at home right now. I'm doing this webinar from my house. You want to encourage sick employees to stay home. If you have a culture at your workforce where people come in routinely when they're sick, when it's kind of encouraged to work when you're sick, you want to take steps to stop that and make sure your employees know that they're not to come in if they're sick. Another important thing is you have to actually ensure your sick leave policies are up to date and non-punitive, and they allow employees to care for sick family members or for themselves when they're sick. So you actually have to have a policy that you should update. And a lot of employers will have policies where you get pointed for sick time or not being at work, and it doesn't matter what the reason is. You have to consider that and whether it could be considered punitive, because there's an actual requirement that these policies not be punitive now. If you need help with that, give your attorney a call if you want to make sure you're in compliance with this. And the next part says separate employees who appear to have acute respiratory illness symptoms. And this may be a pause at first because you don't actually want these people in the workplace. I thought it was a funny provision, but I read on, what it actually means is if you are alerted that somebody in the workforce might be sick with something that's acute respiratory illness, then you need to separate them immediately and have a plan in place what you're going to do with that person until you can get them to go home. So separate them from everybody right away, get them out of the building and send them home. And then you need to clean the area. Another provision is to frequently clean. That's kind of self-explanatory. And be prepared to change business practices as things evolve. There's probably going to be some new regulations. As you know, I think that today is very different where they sat last Monday. So you have to keep up to date and be prepared to make changes. This is a good time to mention, I think last Friday, Carl Hibekoff covered this with Don Ellswick, but a few things under OSHA that were not covered in this stay-at-home order. OSHA is recommending, if you can, provide flexible work hours, provide work from home, maybe stagger shifts if possible. If you normally have your workforce working from 8 to 5, maybe you could have some people working from noon to 8, something like that, so there's not as many people in the building at the same time. Maybe not everybody can work from home, but maybe half the workforce can work from home so that it's not as many people there. You really want to discourage this under OSHA too, people from sharing phones or desks or equipment. If you can do that, make sure everything is cleaned after every user. And I'll cover this a little later, but there's certain materials for cleaning that you should use over others. Under OSHA, they're also asking employers not to require a note from the doctor when you return to work. This is not under the stay-at-home order, but OSHA is recommending this. As physicians begin to be overwhelmed, they're recommending just allow people to return to work without that note for now. Okay, the screening employees, this is a recommendation in the stay-at-home order. The last week before the stay-at-home order came out, Governor DeWine started to encourage business owners to begin taking the temperature of employees when they arrive at work in an effort to identify anyone who's becoming ill. And if you can't do that, ask your employees to take their temperature at home before they come in. If you have a temperature of 100.4 or higher, you should self-quarantine with members of your household. And the biggest reason people are having trouble doing this, employers having trouble doing this, I think, is because you can't find thermometers anywhere. They're hard to buy. I have a family member that works for a big employer. It's essential. They have to go to work. They're doing a drive-through temperature check. So you stay in your car, and the nurse comes up to the window, takes their temperature, and then they move on, so that you don't have people standing in line together, close together, to get their temperatures taken. So I think that's a great idea. If you can't do that, you could separate people 6 feet apart when you take their temperature. Anything you do to keep people from not being on top of each other. Okay, here we go. CDC recommendations are pretty basic, things you probably can guess. So we'll go through them. These are specific to a workplace. Stop handshaking, use non-contact greetings. I'm seeing the elbow bump or waving at people. Don't handshake anybody. They're recommending that you have everybody clean their hands at the door right when they walk in. Schedule regular hand washing reminders by email. I have another family member who works at a restaurant where for the last 3 or 4 weeks they've been getting a notification every half hour to stop what they're doing and wash their hands, things like that. You want to create habits and reminders to your employees that they should not touch their face, that they should cover their coughs and sneezes, that they should wash their hands. So actually signage, something like some kind of reminder for those things. You want to regularly disinfect surfaces like doorknobs, tables, desks, and handrails regularly. So you want to encourage ventilation by opening windows if you can. I know I work in an older building, we can't open the windows, but if you can, do that. Be careful with meetings and travel. Use video conferencing for meetings when possible. Our firm had 12 people on a video conference, all from our houses this morning. If you can do that, that helps a lot. If you can't do that, your meeting should be in a well-ventilated space. Last week we had a meeting where some people were in the office and we were all on our phone in our own offices meeting like that, so we didn't have to get together. If it's possible to keep everybody 6 feet apart, you should encourage that. Maybe even have a meeting from your hallway. If there's not very many people, they can stand outside the hallway of their offices. Or if you're in a manufacturing facility, if you have a large room, keep everybody separated. Or consider adjusting or canceling, postponing large meetings or gatherings. And then you might want to second think any business travel right now. Only anything that's really essential should be done right now. All right, handle food carefully. This is more if your employer is a restaurant or cafeteria, something like that, but also in an office setting or manufacturing, limit food sharing. You don't want to bring in a cake and have everybody share it. You want to strengthen health screenings for cafeteria staff and their close contacts. So just make sure they're really washing their hands, maybe wearing masks if you can find them, keeping everything really clean. Ensure the cafeteria staff and their close contacts practice strict hygiene. Very important, as I said before, tell employees to stay home if they are sick or if they have a sick family member in their home. So if somebody in your house has been diagnosed with coronavirus, COVID-19, or they're showing symptoms, everybody should stay home. You don't want to bring that into the workplace. And this slide here is just the CDC recommendations in one slide where I got most of this from all their current recommendations for the workforce. You can find this on their website. I can send you a copy if you need it. And finally, I think Terry sent out a handout with the EPA recommendations for a list of cleaners and disinfectants. The EPA, and I think this has actually been, you must have gotten the updated list. This has been updated since March 5th. But on March 5th, they published a list of cleaners that are approved for cleaning and disinfecting against COVID-19. And OSHA is also recommending that you refer to this list when buying cleaners right now. So the last final thing you can do is use cleaners only from this list to clean the workplace. And that's it. So if you have any questions, give us a call, send me an email. Tune in tomorrow. Elizabeth Baldock is going to be talking some more about legislative update at 4 o'clock tomorrow. And that's really it. Thank you.